Let's turn to our health spotlight now and welcome in Dr. Jerome Adams, Wish TV medical expert and former Surgeon General. Dr. Adams, always good to see you, sir. Let's start with the big news of the day. If you don't mind, the CDC, as you very well know, says it will ease the mask mandate for public transit next month. That means new rules coming for buses, trains, and airplanes. What should we expect, and are you okay with the timing of that?
Well, let me take that in reverse. I'm definitely okay with the timing of it, and here's what people need to know. The challenge with public transit is you've got to look at interstate. This has got to be something that applies to the whole nation. And while it's good news that many communities are seeing lower cases, we know that there are still communities across the nation that actually have high rates of spread and moderate rates of spread, and they have to account for that. You also have spring break coming up, and people are going to be going in and out of the country to places that have higher rates of spread. So it's a good idea to give us about 30 more days, let the cases continue to come down. And we need to continue to encourage people to get vaccinated, because when those masks come off, when you're sitting next to someone on a plane or a bus, you literally have no protection if you're unvaccinated and unmasked. So I think it is appropriate. And I think what you'll see, because of the way these rules work, is that they're going to have to just say masking is optional. And they're just going to advise people to take their own precautions, advising higher quality masks.
I want to also talk about something that you tweeted about, the president's new plan that allows anyone with a positive at-home COVID test to get treatment and medicines. Is it working the way it should, Doc?
Well, it's clearly not working the way it's supposed to. You hear story after story of person who tests positive but is having real struggles getting the medication. The new test to treat plan still hasn't been implemented yet. Pharmacies have ordered medications, but they still aren't actually in the pharmacies yet. And I'm hopeful that this gets rolled out in a way that allows people equitable access to treatment. It's one more missing piece as we look to transition forward. We want people, if they do get sick, to be able to get treated so they don't end up in the hospital.
Yeah, as more work needs to be done. Something else that you've been pretty outspoken about, the neurological effects of COVID and the study this month that suggests significant harm to the brain from infection from COVID-19. What does that mean, and just how much concern should we have about it?
Well, an important study that came out of England, where they tested people prior to being infected and then tested them again 5 months later. They did neurologic tests and found that those who tested positive for COVID took significantly greater time to complete the test. And they also looked at brain imaging and found that the brain before and after COVID showed a decrease in gray matter, particularly in the areas related to smell and to memory. So the take-home point here for people is it is not inconsequential for you to get COVID, even if you are asymptomatic or minimally symptomatic. That's why I continue to tell people, get your shot, get your booster. It's going to lower the chance you get infected, and it may decrease your chances of having long COVID and actual brain issues down the road.
It's like we learn something new every day about this stuff. One final question before I let you go. I have about a minute left. I know you're a big Colts fan. And since you're a medical expert, let's talk about your blood pressure and stress level today after the Carson Wentz deal. Higher or lower today, Doc?
It's actually a little bit lower today. I'm glad that they finally made up their mind. It's going to be a challenging year, and I'm a season ticket holder, but I'm hopeful that we get someone good in the draft. There's still a few people out there for free agency who I won't be an upgrade, but I don't think will be a downgrade to Carson Wentz, and I'm looking forward to the future. So the blood pressure is okay today.
That's good to know. Fingers crossed. Hopefully we have a good season. Dr. Jerome Adams, always good to see you, sir. Thank you for joining us.
Thank you.